Welcome back to the Banish Cancer podcast. Banish cancer fear together. Today we're diving into a question many people wonder about, but rarely ask out loud. Are all cancer screenings risk-free? I'm joined once again by James.
Thank you for having me. This is such an important conversation because while screenings save lives, they're not always as simple as the more the better.
Most of us grow up hearing that early detection always saves lives, and that screenings are completely safe. Is that true?
Not exactly. Screenings are powerful tools, but they're not perfect. Some people believe a normal result means they're completely safe, or that a test will always find cancer if it's there. In reality, no test is flawless. There are risks like false positives, false negatives, and even overdiagnosis.
So the idea that more testing is always better isn't necessarily true.
Exactly. Sometimes, testing the wrong group of people can cause more harm than good.
Let's talk about those risks. What are the main ones people should know about?
There are 4 big categories. False negatives, when a test misses cancer, giving a false sense of security. False positives, when a test suggests cancer is there. When it isn't, leading to stress and more procedures. Overdiagnosis, finding cancers that would never have caused harm, but still treating them. And side effects. Some tests can cause discomfort, bleeding, or even rare complications.
That's eye-opening. I read that women have about an 85% chance of experiencing at least one false positive in their lifetime.
That's right. And for some groups, like female smokers or pregnant women, the chance can be even higher.
But we don't want to scare people away from screening either. What are the benefits?
The benefits are huge when screenings are used correctly. Early detection can reduce late-stage cancer cases, improve treatment success, and lower death rates. For example, lung cancer screening in high-risk patients has been shown to cut deaths by nearly 40%.
That's a powerful number, and it shows why people feel torn. The benefits are real, but so are the risks.
Exactly. That's why context matters. Screening works best when it's guided by age, risk factors, and medical history.
Can you give us a quick overview of who should be screened and when?
Sure. Cervical cancer screening usually starts at age 25. Breast cancer screening is often recommended from age 40 or 50, depending on guidelines. Colon cancer screening is typically advised up to age 75. Lung cancer screening is for people 52 to 80 who have smoked heavily. But these are general rules. The most important step is talking with your doctor about your personal situation.
So it's not one size fits all.
Not at all. And equally important, knowing when to stop screening. For example, after age 85, most people don't benefit from continuing.
That's something people rarely hear, that stopping can be just as important as starting.
Yes, and it's often overlooked. Continuing unnecessary tests can create anxiety, extra procedures, and even harm.
If someone listening feels overwhelmed, what's the first step they should take?
Start with a conversation. Ask your doctor, which screenings do I need? Why now? What are the risks? Shared decision-making is the best way to feel confident and informed.
And for those who like to research, stick with trusted sources like the American Cancer Society, the U.S. Preventive Services Task Force, or Cancer Research UK.
Yes, because misinformation online can make people either overly fearful or overly confident. Reliable sources help you strike the right balance.
I think that's the heart of it. Balance. Not fear, not blind optimism, but informed choices.
Exactly. And when people feel informed, they feel empowered, not pressured.
This has been the Banish Cancer podcast. Banish cancer fear together. You are not alone.